So good evening, I suppose it is there.
It is, yeah. It's actually quite late here. It's around 9:30 here. So it's
Right. Sorry for the trouble, but we really needed the discussion.
yes, of course. Yes, I think this is the best time. I don't know if people in India can even join us. They must be working at the moment, but hopefully,
Some are, yeah, some might be, but it's the lunch or the break hour here, so probably they will.
yes. Okay.
So, guys, Dr. Lakshay completed his BDS from India in 2009 from the dental college here. Then he did the internship and residency from MAIDS, that is the Maulana Azad, and in 2009 and 2010. Then he cleared the council exams in 2013 while he was working in a clinic in Delhi. Then in 2013, he went to New Zealand. He got NZDREX, that is New Zealand Dentist Registration Examination, and MFDS RCSED, that is the Diploma of Membership of the Faculty of Dental Surgery of the Royal College of the Surgeon of Edinburgh. And he did the lasers program, and after 7 years he opened up his own practice, and since 1.5 years he's running his own practice by the name Sunny Nook Dentist in Auckland. And also, if you see the Google reviews, it's almost the 5 stars of many people who have recommended or given the feedback. So a very warm welcome, sir.
Thank you so much for your kind.
We know the plus of the New Zealand. Are there any negatives also? Or maybe
It's a
just
small.
the opposite? Yeah.
It's quite a small country, so that's the negative. Things are quite expensive here. Uh, l- uh, the day-to-day life, you whatever you buy and all these things are quite expensive. But either taxes are quite high, so you pay
Okay.
around 30, 35, 33% tax. And
Okay.
as a dentist, you have to pay what we call as GST, which is around 15%. So taxes are quite high, but they're paid to you in the way of really good roads,
Yeah.
good infrastructure, and so it comes back to you. Good
Right.
schools and good lifestyle. So yeah, I mean, so there's always pluses and minuses, but I don't think that does make a big difference.
Right.
Yeah.
So what exactly is the stepwise procedure? It's just two questions. How to apply to New Zealand and what is the scope and opportunities. But answer these two questions is such a huge thing. It's like you
Yeah.
can maybe write a whole book on that because it's such so many vast thing to add on. Sir, so
Yeah.
what is the stepwise procedure? Like after a BDS, after we have done our BDS, how to apply?
Yeah. So before that, I'll definitely advise that anybody who's completed BDS should at least have at least 1 or 2 years of experience before they even plan to give any exams abroad, because it's not only passing these exams, you have to practice there. And if you don't know
Yeah.
dentistry, you won't be able to survive there. So definitely, get into that clinical practice, get into a good clinic or an institute where you'll be able to do a lot of procedures. So once you're confident in most of the procedures, and you're more confident that you can go through these exams. So for New Zealand, like when I gave the exams, we had the New Zealand Dental Council conducting these exams, but maybe because they didn't get enough candidates to give these exams, they've outsourced these exams now to
Okay.
the Canadian board and the Australian Dental Council. So you have two pathways to go into New Zealand. One is you can go to the Canadian board. Um,
Right.
you do the assessments with the New Zealand Dental Council. That assessment, I think, costs you around $500 to $600, and
Okay.
then either you can go for the Canadian board or the Australian board. So, for example, if you go for the Canadian board, you have to give the first exam, which is called AFK. I think it's Assessment of
Yeah.
Fundamental Knowledge. It's a written exam. Um, you give that exam, and I did write a few notes on that, so I'll just quickly open that. But yeah, so you do give those exams, and that's a written exam.
Okay.
Yeah, perfect. So AFK, you get 3 attempts. It's a 6-hour exam,
Okay.
and I think the cost is around $1,000, if I'm not wrong.
Okay.
Then there is once you pass that, you can give a clinical exam, there are two parts of the clinical exam. One is the clinical judgment exam, ACJ, and there's a
Okay.
clinical skill exam, which is the ACS. So the clinical judgment exam is a 6-hour exam again. You've got 3 attempts, and then it's based in Canada, so you have to go to Canada to give it. And it's around 1,350 according to the website there.
Okay.
And assessment of clinical skill is a 2-day exam.
Okay.
And that's a 6-hour each day, and that's around $9,000. Again, you get around 3 attempts to do that.
Okay.
So I think the AFK exam, there are centers abroad as well. You can give it, but mostly in Canada.
Yeah.
And the rest 2 exams can only be given in Canada. So you can't, I think there's a question there, where is the exam conducted? So I
Conducted.
think that answers your question, Tanvi. Yeah.
Yeah.
So that's for those exams. Again,
Sir,
all this information. Yes,
yeah.
yeah, you were saying something?
So, yeah, so this means if we are eligible to work in Canada or in Australia, we are also eligible in New Zealand.
So that's a gray area. I think if you have to go for these exams, you can do the assessment in Canada and in New Zealand as well.
Right.
So then if you give these exams, you can practice in Canada as well as New Zealand.
Okay.
But if you just done the assessment in with New Zealand Dental Council, then you will only be able to practice in New Zealand. Anyways,
Right.
after you get your registration in New Zealand, you can get a transfer to Australia, but you can't get a transfer to Canada through these, just if you've just done the exams.
Okay.
But if there's another pathway to do a registration in Canada, in which you join a university. After the AFK, you can apply to universities, you can do the bench test, and you can get into the universities. If you do that, then you are able to practice in New Zealand and Australia. You can get a transfer, because your primary degree and your registration is based on a Canadian degree.
Yeah.
So then you can transfer. So it's a bit of a gray area. I would suggest, if you're planning to keep your sources open, or your options open, then make sure you do your assessment in both the councils then.
Right. So there is something called as prescribed qualification or non-prescribed qualification. I read it somewhere.
Yeah. Yes. Good question. Unfortunately, no college in India is prescribed qualification. So we don't fall into that category unless you have international, followers. But yes, for them, if you have done your BDS from anywhere from Australia, New Zealand, Canada, US, and there are a lot of universities in that. Every council has different prescribed qualifications. So if you've done your BDS from those countries or those universities, then you do not have to give these exams. You can actually directly apply, and you can get into.
Right.
But yeah, unfortunately, India doesn't. No college in India falls in that category.
Then we have to give the exam of the New Zealand to get specialized as a general dentist, I guess.
Yes. So yeah. So either you give the Canadian board exams, or you give the Australian board exams. Again, the Australian board exams are Australian council exams. They have the theory part and the practical part, and you get these exams, and once you pass them, then you can get your council registration with the Australian Dental Council, and then you can transfer it to New Zealand. So that's what you can do as well.
Okay, right. So, sir, what are the things we should make sure that doesn't go wrong if we are applying it for the first time?
One thing very, very important is, don't botch up your all the assessment papers that you give. So your application process should make sure you read it very well, you answer the questions very well, you attach the documents I've asked to properly, because the assessment process takes a lot of time. And if you do not do it properly, they usually send it back. So all the time, there are around 3-4 months that you'll waste that time. So make sure you read and you properly attach all the documents. all of them are quite black and white, but if you have any questions, you can always email the councils. The council is very, they're quite consistent in replying back, and they usually don't take a lot of time. So they would be very happy to help if you have any questions.
Right.
Um,
And sir, I
and
guess there is one, yeah, there is one site called dcnz.org.nz, I guess. So this, we have to refer to this for all the details.
Exactly. So that website is beautiful. It's got everything written in it, each and every point. So make sure you go through it very well before. And this is one thing that I usually see. A lot of people message me or email me, or just DM me that, sir, I'm a dentist in New Zealand, in India, and I want to practice in New Zealand. Can you tell me the procedure? So again, I'm not going to even bother to answer because that's such a huge topic. So always do your research when you're going to ask somebody. You should always ask relevant questions like, I have looked at this, but this is a doubt. I don't know what about this
Yeah.
point. What should I? So always ask questions. If you want to ask for help, always do your research before you ask. Otherwise, it's very hard for people who are already working and having a busy life to go in, and we want to help
And also,
everybody. Yeah,
yeah.
everybody wants to help. There are a lot of people who want to help, but yeah, we want to help the people who actually do some hard work or some homework
And so
before they
these
ask.
questions generally suggest that the candidate is really serious and thinking about the what
Exactly,
question he's asking. Right.
exactly.
Sir, so what is life of a dentist in New Zealand? Like, what about you? What are the working hours? What are the holidays? Because you are really interested in travel, I guess. So how do you
Yes, yeah.
manage? Yeah.
So, yeah, life in New Zealand is quite laid back in general. We usually have weekends off, but if you're working in a city, you might be working Saturdays. So, like I work Saturdays, but I take a Friday off. So,
Okay.
or I work an alternate Saturday or something like that. So yeah, you just have a good work-life balance here. What was the next other question that you asked?
Uh,
So,
like, how do you balance it?
how do I balance
Like,
it?
what is
Yeah,
the life of a dentist? What are your
yeah,
working hours? It means like you
yeah,
work only 5 days a week for sure.
yeah. I try
It's
to
not
work.
like
I've
India.
worked.
Sometimes you're working 7 days a week.
Yeah, yeah. No, I've worked 6 days for some time, but then
Okay.
as I realized it, I think I started working 5 days now. But
Right.
yeah, working hours are usually 8:30 to 5, so it's a
Okay.
one stretch work. You don't work like India where you work mornings and evenings. We usually work from 8:30 to 5. Generally, we might have a late night in a week, but then we start late as well. Um,
Yeah.
we do get like New Zealand. Usually, people will take at least 4 weeks of holidays in a year, so that's a month of
Okay.
holiday.
Yeah.
And if you're doing really well, you might take around 6 weeks. So yeah, so there have been years when I have taken 6 weeks. There have been years that I've taken 4 weeks holidays, but 4 weeks is minimum. Otherwise, you just burn out. So yeah,
Wow.
there's definitely some. Yeah,
Okay. Sir, so
yeah.
now the most important question, what is the scope and job opportunities? And what if a MDS from India is planning to go to New Zealand? The process remains the same for as a BDS?
Yes, if you want to get registered as a general dentist, yes. If you want to get registered as a specialist, there's a specialist exam as well. But what I have heard, and to be very frank, they're quite hard to pass, and there are one-shot exams, so you can only give it once, and they're quite expensive to give. So I don't know of anybody who has given those exams or cleared. I do know of a
Right.
dentist who's cleared the exams as a specialist from the US. So he was practicing in the US and then he gave the exam. So yeah. So I
Oh,
would say the only way to come here is to give these general dentist exams, and then you can, as a general dentist, you can practice a bit of specialization. But yeah, means you won't be registered as a specialist. Um,
right.
and job opportunities are really good.
Yeah.
I would say there's enough jobs. There's a website called the Dental Council. So New Zealand Dental Association, that's called nzda.org.nz.
Okay.
and it's got a classified section. So if you Google NZDA classified sections, you will see the job listings in New Zealand, and I would say on an average we would see around 10 to 30 jobs always posted on there. So
Okay.
there are good job opportunities, although when you first come to New Zealand, you might have to go to a rural city or a rural town or a smaller town. So you might have to start there, and then eventually, as you get experience, you get more job opportunities in the city. That's how I worked. So when I first started, I started in a town where with only 6,000 people, and then eventually I moved to a bigger town, and then finally to Auckland, where I feel I'm
Okay.
more
Yeah.
like Mumbai.
Yeah, right.
Yeah.
Sir, so are there any diploma courses? One option we have is work as a dentist in New Zealand. Other than that, if we are a dentist in India, what options can we or what things we can do there? Maybe MPH, forensics, MHA.
So you can do MPH, you can do MHA. There's other non-dental degrees that you can do as well, but all of them, it is slightly difficult to get a job on a
Okay.
visa, and the residency process or the PR process, which is usually the ultimate goal of a person who's migrating to another
Yeah.
country, is slightly harder. It depends on if you do get a proper job or not. So
Right.
there's a lot of risk when you go into that fields. I didn't want to go into that through that path, but I know a lot of people who have gone through that path and they've done well. So so you have to be sure what you really want to do. If you really want to practice in New Zealand as a dentist, I wouldn't advise you to spend money and time and effort towards that. I would advise you to give the exams because it costs the same, almost actually more to do those courses than to give the exams. But there's public health, which is quite relevant. There is hospital administration or healthcare administration, which is quite relevant to our field.
Right.
That's what I would suggest. Any other
Uh,
course, you will be leaving
yeah.
dentistry then. Yeah.
We have a question that can we study PG course there?
Yes, you can study PG courses there. You can apply for them, although the fees of an international student is quite high. They can go up to around 40 to 70,000 New Zealand dollars a year, which is quite high, I would say.
Okay.
Although you still may have to register as a general dentist. Again, this is a bit of a gray area. So when you apply to for any courses, make sure you email the dental council asking, I'm doing this course. Would I be getting a general dentist or a specialist registration after that? From what I
Right.
know, there are not many courses that do. Actually, none of these courses. But there was some
Right.
talks that they would be starting this registration process for specialists if they do specialization courses, but I don't know if they have been formalized or not.
Okay. Right. Sir, so what do you think regarding when we as a BDS are coming from India to New Zealand, what are the basic procedures we should be confident about so that we can start our practice early on we are confident in whatever work opportunity we get there?
Such a really good question. So I would say if you want to start your practice, there's a lot more that you need to know. More than just dentistry, you need to know a lot of paperwork. You need to know a lot of government rules and all these things. So I wouldn't suggest somebody to come and start their practice straight away. I would suggest them to work
Right.
for 1 or 2 years. But in general, you should know. You should have good clinical skills to be able to perform all the general dentistry. So you should be able to do good fillings, proper with good isolation. You should be able to do at least general root canal treatments, at least anterior to
Right.
premolars. You should be able to do normal extractions. You should be able to do crowns
Maybe
and
impression
bridges.
taking, X-rays,
Of course, yeah,
of
X-rays.
course.
That's so the exam process is designed in a way that they judge you on these skills, and if you can pass these exams, I think you'll eventually be a very good dentist. So this whole process of the exams makes you a very polished and confident dentist. And I think if you're studying and you're preparing for that, you will automatically have these skills already. But
Sir, the
more than
yeah.
anything, I'd like to add is more than anything, you should know how to communicate. That is very, very important here. You should be able to talk to patients here. That is more than any clinical skills. You should be able to you should explain your treatment plans. You should be able to explain why this is happening to the patient, and that's the more important thing here. You in India, maybe if a dentist or a doctor tells a patient that this is what you need, they'll just take it on face value. But here you have to they're equal to you, and you have to explain them. They're part of the whole process making, decision making, and they
True.
want to be involved in the process. So yeah.
So I would share that in the last 2 to 3 years, probably the situation has completely turned over in India also. The
Very
dentists,
good.
I mean, like the patients are smart enough and they choose and they want to be a part of the diagnosis and the treatment, and they want to really
Very
choose
good.
and get the options available.
Exactly.
So yeah, things are changing here too. So I'm happy regarding
Very
that.
good.
So yeah. So there was the exam that is the NZDREX, the New Zealand Dental Registration Examination. So what happens in that? How to study for this?
So yeah, this is NZDREX was an exam conducted by the Dental Council of New Zealand. So it was called Dental Council Registration Examinations. Unfortunately, that's
Acha,
no
okay.
yeah.
Okay, right.
So
This
so
was
that's
which is
why
banned. I mean,
yeah,
like
no
which is stopped.
yeah, they've discontinued that
Okay.
because now
Yeah.
they felt that it's better if they outsource it to the other councils who are conducting
Right.
exams at larger scale. So Australia conducts exams at a very large scale, Canada conducts
Yeah.
exams, so they are outsourcing it to them, and they are considering people who have passed those exams. So yeah, NZDRX is not something that is relevant anymore for yeah.
Right.
So either you
And so,
give the
yeah.
NB, what is it? I think it's NDPE.
Yeah. And yeah, we got it.
Yeah, and or the
Okay.
ADC exams. So these are the two exams. So the Canadian exams or the ADC exams. Yeah.
Okay. Sir, so how you got into the Royal College of Surgeon of Edinburgh? You applied for it. How you got there?
So at one point when I started dentistry here, after 1 or 2 years, I felt like I wanted to do post graduation. And to do post
Yeah.
graduation, you have an upper edge if you have a fellowship or a membership of the Royal College of Surgeons. So I researched it, and I had just given the exams. So I had studied for most of the exams, and I at that time these exams were conducted in Scotland. There's a different Royal College of Surgeons which is for England, and there's a different Royal College of Surgeons for Australia as well. So the Australian
Oh,
Royal College of Surgeons, they usually have exams which have non-clinical papers as well. But the Scotland one had clinical papers. So I applied for that, and they have two-part exams, a theory part and then a practical part or a OSCE part. So
yeah.
once you clear both of them, you get a qualification which is MFR DCS, what I've got. So you usually have to go to Scotland to give these exams. The theory exams are conducted in Malaysia, in India as well, I think, and
Okay.
and Scotland and England. So I gave my theory part in Malaysia, and then I went to Scotland to give my clinical parts, and that's how I got this qualification. Although after I did that, I felt that general dentistry is enough for me, and I'm quite happy doing what I'm doing. And I opened my own clinic. So I did not go for post graduation, but I just did the framework for it. So I'm like a guy who, if I want to do something, I just do it. I don't think about how it's going to help me on. So that's what I would suggest everybody here. Just go for it. Don't keep thinking about it. Don't procrastinate about it. Just do it. Yeah.
Right. Sir, so there is a question like, are there any particular dates, months for appearing to the exam? That we have to check, I guess, with the Canadian and the Australian boards.
Yeah. So I think the Australian board conducts the theory exams twice a year. And in the latest thing, the practical exam is conducted every weekend now. So it's they have
Okay.
so it was quite decentralized. The exam was going on everywhere, Now the exam is only conducted in Melbourne, and they've put a new facility where they can conduct exam, I think, monthly or weekly. So the practical exam you can give around 5 to 6 times or even more in a year,
Yeah.
for the Australian one. For the Canadian one,
Can it?
I would be very frank, I'm not very sure about this. I think it's best to go to the website and look at it.
Yeah.
When we were giving the New Zealand dental exams, we just got 2 theory attempts and around 3 practical attempts in a year. So that was the dates. So if you're looking at giving these exams, I think it will take you around, the whole process will take you around 1 to 2 years. 1 year if you're really quick and really good. I think 1.5 years would be an average. 2 years would be something that you would be looking at. If you don't clear a few exams, which is possible, don't get disheartened. You know, these exams are hard, so you might have to give a few attempts, and then it can go up to 3 years. But more than 3 years, I don't think it's worth trying. Then it's better what you're doing. Yeah.
Sir, so there is one more question. Only for work can we go to New Zealand, or we can study PG too?
So if like there could be a few meanings of this question. So if you're looking at going to work as a dentist, you have to be registered as a dentist, so you have to give the exams. If you're looking at going to work for something else, like a dental assistant for something else, then it's actually really hard to get a visa on that, because there are other people here who would be more eligible for those jobs. The only way where you can become a dental assistant is if you study here, do some course, a 1-year course, and while doing that, you find a dental assistant job. And
Yeah.
again, you should be lucky enough that the employer is ready to sponsor your visa after 1 year, or sponsor you for your PR. So which is a bit tricky. I wouldn't recommend, doing that or going towards that. I would say just go with caution. That's you may end up spending a few years and then eventually have to come back to India if your visa doesn't get extended.
Right. Sir, so when we work as a dentist under a senior doctor there, so what is the minimum, the basic pay that definitely we will be getting?
As a dentist or
Yeah, as a dentist.
as a dentist? So you would start at around 80 to 100,000 a year. That is New
Oh,
Zealand dollars. So you're
okay.
looking at around 1,500 to usually we get weekly pays here. We don't get monthly pays. So you'd be
Right.
looking at $1,500 to $2,000 a year. Again, this is a good salary, but not like, I would say it's a comfortable salary, but
Yeah.
it's not the best. As you progress in life, you can go up somewhere around 200,000 a year.
Yeah.
Again, if you convert it into Indian money, it looks a lot, but things are expensive here. So
Here too, right.
yeah. House prices are quite expensive. So like, for example, a house would cost you around $1 million minimum here.
Yeah.
And if your salaries are around 100,000 and your expenses are around 60 to 65,000 a year, you're saving only 35,000. Okay, so yeah, so it means you definitely are in the first 10% of the population here if you're a dentist, earning wise, and you'll have a comfortable life, no doubt in that. But yeah, it's not that you'll be the richest person in Auckland. Yeah.
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 Okay. So, sir, this is my questions. My rest of the questions are over. But regarding the communication, because you emphasized, and I really believe that communication is a major part when you are in a dental clinic, and it is not taught in the dental schools, at least in India.
Exactly. Yeah.
And whenever we join a dental clinic, if the patient comes and doesn't report back for the treatment, it's the first dentist who got the consultation done is like type of a blamed, or we, tend to, see कि that उसने अच्छा consultation नहीं किया होगा. That is why. So how
Okay.
exactly some tips for the consultation or the communication?
So, in dentistry, when we were doing, we used to take case histories. So you
Yeah.
have to actually, you have to make your own small, precise case history when you're doing a consultation. You have to ask about a lot of things which you feel could be relevant for the patient, for whatever thing he's coming in. So if he's coming in for it's not something that I would suggest you just ask over, just standing over the patient. You just write it down. That looks more professional,
Yeah.
and that looks good.
Right.
And you're actually taking that effort. That's one thing. Other things is, do your diagnostic really well. Make sure you do all the tests. You do cold tests if needed. You do the X-rays, and do not just jump into a diagnostic straight away. You have to spend that 5-10 minutes, 15 minutes to do the diagnostic, to talk to the patient, to ask the patient, take that effort, and then you have to explain the patient, this is the X-ray, this is what is happening. You can draw some diagrams. As long as you are actually involving the patient, I think the patients, they understand, they feel the importance that you've given and in explaining them, and then they stay with you always.
Right.
Moreover, you have to be very truthful in what you're doing. You're not here for the money. The money comes as a byproduct. You're here to serve people, or to get that satisfaction when you're working. And the third point, most important, is you have to give options to the patient. A lot of people just tell the patient, okay, this is what you need. And it's not the day of age where we just shove down our own thoughts to other people. You have to actually give them options. Okay, this is the first option, this is the second option, third option. If you do the first option, it's definitely cheaper, but this is the advantages, this is a disadvantage, this is the second. So give them the three options, let them feel that they have the control, and once they have that control, they'll get that trust as well, and then eventually they'll like to just stay with you always. They'll actually come. You'll be surprised. A lot of people will even they'll go to another city or something, but they'll still come to you for your dentistry. So that's the type of dentistry you want to achieve. Yeah.
Right. And sir, somehow I believe that if from 100 patients you treated 100 patients, if 10 doesn't report back or have something different opinion on your work on something, and that is okay, because it will happen at the end.
Yeah.
So
you lose some, you gain some. Yeah. Sorry.
Yeah. So do you have any plans on coming back to India? I know no, but do you still register for the dentistry registration here?
I love India. That's a fact. And I love when I come back to India. I like every time I come, I'm amazed. Like things change so quickly. And, but like once you're comfortable living somewhere, you've bought a house, you've made that. It's very hard. I call New Zealand my home because I've worked hard to be here, and I've adjusted here. So I don't think I have plans to come back to India to settle or to work. I may come back to work if I really get a very good opportunity. But yeah, like I'm quite comfortable here. But I love India. To be very frank, I'm quite amazed whenever I come to India. The lifestyle that you can have in India, if you're earning well, you can never have anywhere in the world. Yeah.
Yes. Right. So we have another question that can you please suggest the good course in Canada after BDS in India? For Canada after BDS in India, there is already a video, but sir, your suggestions on it.
I'm actually not the right person to ask this question, but if you want to do, I think the courses remain the same. Like all these courses, the MPH, hospital, these are quite relevant to your dentistry. And if you do a non-relevant course, you actually are minusing all the hard work that you've done for 5 years doing that BDS. So I wouldn't recommend that to anybody, but the courses remain the same. But again, I think the satisfaction and the lifestyle that you'll have after completing these exams or doing a dental course or to get DDS there would be something that I would motivate you towards doing, because that's the best, I would say.
Right. Sir, I guess you have answered all the questions, and this headphone wired one worked. So sorry for the inconvenience at the starting.
Okay. Yeah, no, that's fine. I totally understand. I think I should have known this before, but now I know.
Yeah, we both know now. Okay, so we will you have a very good night, and thank you so much for joining. Okay, so last question. Does doing dental hygienist works?
So yeah, dental hygienist or dental therapist. These are dental hygienists will only do dental cleans, and dental therapists can do the cleaning as well as they can treat children here. That's another course which is really good. It's a 3-year course, again an expensive course. It will give you a good job, a decent job, but not as good as the dentist, almost half as the pay. And University of Otago, New Zealand conducts that course, and AUT, Auckland University of Technology, they conduct. So these are the two institutes that conduct that course. You can register as a dental hygienist or a dental therapist by giving some exams as well, although I've heard that those exams have been discontinued. So when I was giving the exams 7-8 years ago, I knew that that was the option, but it was again an expensive option. Might as well give the dental council exams rather than giving those ones. So yeah, you can do these courses if you want.
Okay. Okay. Thank you so much, sir. Have a good day. Have a good night and sleep well. Thank you so much.
Thank you. All good. Thank you, guys. Okay. Perfect. Bye. Good night. Bye.
Take care.
Bye.